When talking about symptoms from neurological dysfunction in elderly patients, one of the common symptoms that we see is confusion. When elderly people are confused, they find themselves disorientated, they're not aware of where they are, who they are. It's always an ominous sign, something is not right, especially if it has occurred in a short period of time, suddenly occurred, or over a period of 1 to 2 weeks. This is one symptom which is easily missed, easily overlooked, and I think it's something which we should pay more attention to because it may be a symptom of something rather sinister happening within the brain. Other symptoms would be frequent falls. Yes, elderly patients are weaker, they do suffer from joint pains, they do suffer from muscle weakness, hip weakness, and they do tend to at times trip over. But the reflex mechanism sets in. They become more careful. They're a bit more careful in how they walk to avoid such falls. But having said that, if you find your parent or someone elderly that you're taking care of is frequently falling, even from a standing situation, he's standing upright and then he loses his balance and falls right back down, that is not a symptom to be overlooked. It's something which needs to be looked at rather seriously because it may be a symptom of a blood clot within the brain or something even more sinister like an undetected fracture. Pains and aches in the elderly are quite common, but certain conditions where they complain of diffuse back pain or diffuse pain in their legs, chronic headaches, these are symptoms which are commonly seen in elderly and should never be overlooked because chronic headaches, back pain which is persistent may harbor symptoms of a blood clot within the brain, a pathological fracture of the spine, or something even more sinister than that. Even I am guilty of just ignoring pains in the elderly, pains in the joints, pain in the back, pain in the head, pain everywhere. When in actual fact, certain conditions where pain is significant and should never be overlooked is consistent, persistent headaches, persistent back pain. I think these symptoms need to be looked at rather urgently to ensure that we don't miss out something more sinister.